بسم الله الرحمن الرحيم. الحمد لله وحده والصلاة والسلام على من لا نبي بعده. أما بعد, Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr Zakaria Guennoun, consultant in diagnostic radiology, currently practicing in Saudi Arabia. Just a quick talk about the basic principle of breast MRI technique. In fact, it's not that complicated, and the sequences used during breast MRI are pretty basic. And as a general reminder, gadolinium contrast is required to detect cancer. In fact, it's not just a contrast-enhanced MRI of the breast, it's dynamic contrast-enhanced MRI of the breast. Why did we add term dynamic to this procedure? Because contrary to other MRI exams which need contrast injection and which include only two phases, the pre-contrast and the post-contrast phase, to assess if a lesion has enhanced or not. Here the dynamic term means that we do multiple post-injection scans to evaluate the behavior of lesion enhancement over time, which we call kinetics. So that our main concern is not only if a lesion has enhanced or not, but we need to know how this lesion is enhancing over time. From that we can draw a specific kinetic for each lesion. We'll look into that shortly. First of all, when to schedule breast MRI. It was believed that breast MRI should be done during the second week of the cycle, but no paper has demonstrated any benefit of doing that. Technically, you can do it at any time. We need a 1.5 or 3 Tesla MRI machine, and the sequences used are straightforward. We have T2 weighted images to evaluate fluid content of any lesion, T1 without fat saturation, used usually to assess any architectural distortion or any mass effect, T1 with fat saturation and without contrast injection, which will be used as a baseline to compare with T1 weighted images with fat saturation and with contrast injection. And we have subtraction images, which are images processed by the machine, which will subtract the T1 weighted images fat saturated without contrast injection from the new T1 weighted images fat saturated with contrast injection. It will allow us to detect any gadolinium intake into a pathological lesion and discard the noise of the background parenchymal enhancement. The images, of course, have to be acquired in high resolution with slices less than 3 mm. As for the dynamic protocol, it consists of 1 pre-contrast scan and 3 to 5 post-contrast scans, each lasting 60 seconds. Each scan is separated by a 10-second delay. And we know for sure that the peak of contrast enhancement for breast cancer will be reached at 90 seconds after contrast injection, in such a way that the peak of contrast enhancement for breast cancer will be seen in the second post-contrast scan phase. But either way, you'll have to also compare the first post-contrast phase to the last post-contrast phase to evaluate the behavior of contrast enhancement of a lesion. In fact, there is some balance to be made during breast MRI between spatial resolution and temporal resolution. Spatial resolution will be obtained with thin slices, and it's great to analyze the morphology of the lesion. Temporal resolution, on the other hand, will be obtained by performing multiple post-contrast scans, and it's great to analyze the kinetics of the lesion. So much so, if you do multiple post-contrast scans, you won't be able to do high-resolution images, so you will lose some spatial resolution. And on the other hand, if you do images with very thin slices, you will not have time to do multiple post-contrast scans, and you will lose some temporal resolution. In the end, there will be some compromise between spatial and temporal resolution. And in my opinion, spatial resolution should be prioritized over temporal resolution, because the main factor for interpretation of a lesion on breast MRI will be morphology before kinetics. So to come back to kinetics, why is it so important? Because during the evolution of an infiltrative mass in the breast, there is development of an angiogenesis, which will help the tumor grow. And these new vessels are abnormal, with porous leaky walls in such a manner that if you inject contrast into the body, the uptake of contrast by the tumor corresponding to its enhancement will result in an ascending kinetic curve, but then the leaky walls of the angiogenetic tumor will result in a leakage of the contrast and washout corresponding to a descending kinetic curve. Though ascending, then descending kinetic curve corresponding to the third most suspicious form. First one corresponding to continually progressive enhancement seen in benign lesions. The second form corresponding to a slight ascending enhancement followed by a plateau seen in most benign lesions also. A few words on subtraction subtraction sequences. While it is really good to increase sensitivity for lesion detection, this sequence is very sensitive to proper technique. You'll have to make sure that the heart is bright in subtraction images, and even correlate your subtraction findings with native T1 fat saturated contrast enhanced images.